Hello viewers, I'm Dr. Reem Khan and today we are going to continue with our topic of male infertility. In this video, we are going to discuss the diagnosis and the tests. And if you have not seen our previous video discussing the symptoms and the causes of male infertility, we are also going to provide a link in the comment section for that one. And if you would like to learn more about infertility, pregnancy and parenting, please subscribe to our channel. So the treatment for infertility depends mostly on the cause and your goals, your age, how long you've been trying to conceive, and your personal preferences are factors in deciding on the treatment. Sometimes one person needs treatment, but other times treatment involves both the partners. In most cases, people and couples with fertility have a high chance of pregnancy. Things like medication, surgery, or assisted reproductive technology, also commonly known as ART, can help. Often, lifestyle changes or improving the frequency and timing of intercourse can improve your chances of pregnancy. Treatment can also include a combination of methods. So, for infertility treatment, it can be done through medications or through surgery. For medications, it can raise the testosterone or other hormone levels. There are also drugs for erectile dysfunction to help maintain an erection during sex. And for surgery, some men do need surgery to open blockages in the tubes that carry sperm or to repair the structural problems. For example, a varicocele surgery can make sperm healthier and improve the odds of conception. If the problem is related to semen analysis, that is the sperm count is low or the sperm motility is really bad, then the treatment that can help conceiving is assisted reproductive technology, that is also commonly known as ART. ART is any fertility treatment that involves a healthcare provider handling the sperm or the egg. And also to increase the pregnancy odds, they can provide medications to the female partner to stimulate ovulation before trying one of the options from the ART. So the ART has 5 options: IVF, ICSI, IUI, assisted hatching, and third-party ART. Now we are going to describe in detail all of these. So IVF, which is in vitro fertilization, involves retrieving eggs from the ovaries of the female partner and then placing them with sperm in a lab dish. The sperm fertilizes the eggs artificially outside of the environment, and then a provider transfers 1 to 3 of the fertilized eggs, which are then the embryos, into the female partner in their uterus. The second one, which is ICSI, intracytoplasmic sperm injection, is a procedure that may be performed during the IVF process. An embryologist injects a single sperm directly into each egg. Then a provider transfers 1 to 3 of the embryos into the female partner. Third is the IUI, the intrauterine insemination. A healthcare provider uses a long, thin tube to place sperms directly into the female partner. IUI is sometimes called artificial insemination and is very commonly seen in people having decreased sperm motility, decreased sperm count, and blocked tubes. The fourth one is assisted hatching. This is a process that involves opening the outer layer of an embryo to make it easier for it to implant in the uterine lining of the female partner. Then is the third-party ART, in which couples may use donor eggs, donor sperms, or even donor embryos. Some couples might also need a gestational carrier or a surrogate uterus to implant their embryo. So these were the common treatment options available for male infertility. So in our next video, we are going to discuss the complications of the treatments that we have just mentioned. Please stay tuned and take good care of yourself.